So the program Well Body Talk, where they come to you from the Society for Radio Democracy 98.1 FM. Well Body Talk na program where they come to you every Thursday from 5 to 6 o'clock even 10. Also, we dey talk about different sickness, wetin dey cause them, and self how for prevent and self treatment. And we dey always get experts in the studio for talk about different sickness. And inside this edition of the program Well Body Talk, we studio guest when our Dr. Rosalita Jaida Tugwago, when a senior registrar Ops and Gyne Department na the University of Salon Teaching Hospital Complex, as in there so today for talk about menstrual hygiene and dignity. And where they present the program come to you this Thursday evening, my name na Karifa to Conte. And members say yourself where they listen and watch you live na Facebook, you go be part of the program by way I go send a comment or text message to the number 07798191. Or if you go now here the Democracy Facebook page. Inside the program, we get for open phone line. Also, people will call the number 07798191, 07798191, at the number where you go call later on inside the program. As today we dey talk about menstrual hygiene and dignity. Well, with that, I want to say good evening and welcome to the program Well Body Talk. Good evening, Dr. Rosalita Jaida Tubago, and welcome to the program Well Body Talk.
Good evening. Good evening, Sir Leone.
Okay, well, as today na your first time this for come na the Well Body Talk program, so go on for no more other than Dr. Rosalita Jaida Tubago na the medical field.
Okay, me an obstetrician gynecologist. We still train for be consultants. They work na the Princess Christian Maternity Hospital. We na part of the University of Leone Teaching Hospital Complex, and they also work for the Ministry of Health.
Okay, so for how long you done the practice?
I done the practice now close to 8 years now.
Okay, so how you can describe the role where you play in the medical field?
Well, I will describe my role as being essential because for provide services for maternal health, we are one of the buildings and we get in this country the high maternal death and morbidity. So now maternal health me they provide services for all this why. And me work hectic. We can actually be very busy. I just come on run a long antenatal clinic. I take me back care.
8 years of service.
Yeah.
You enjoy profession?
Yeah. When you look at some of the women they waking calm, then desperate, and how the families they can come desperate. As recent as Tuesday, somebody come where they see and say this return you back, they die, and then. Okay. After some minutes, after some interventions, you see this person begin come back to life. Then you go say, well, even though me work is not so lucrative, but I go say the way at the poor people in a desperate situation is worthwhile.
Okay. A name na Dr. Rosalita Jaida Tubago in the senior registrar Ops and Gyne Department na the University of Salon Teaching Hospital Complex. As in that so today for talk about menstrual hygiene and dignity. The program na Well Body Talk, they come to you live from the Society for Radio Democracy 98.1 FM. Yourself can be part of the program by way go send a comment or text message to the number 07798191, or self you go now Radio Democracy Facebook page. So now look to the topic proper we look at today in the program with menstrual hygiene and dignity. So start for tell you within a menstruation.
So menstruation bleeding where woman then can get or woman they get every month, and the womb, what they call the uterus, it get 3 layers. The inner layer of her, that the inside part of her, can actually shred every month. They are in the menstruation where woman they get, and if that they happen, then we they say the woman they get regular menstrual flow. But some people the menstruation it can be long, it can take long period for make them see the menses, and then some people they can see really short. So then one day we can say the menstruation is abnormal. So normally we can say 21 days to up to 30 days. then you can see say this person I dey within normal range. But if e be say the person dey below 21 days or e dey below then 30 something days, then you go now begin think say this woman a menstruation don prolong. But na normal physiology, not to anything strange. Na thing wey suppose to happen till the woman reach menopause. That time dey na way you go say biologically this woman no dey born again at that time dey. So na from puberty to menopause that dey happen. And a normal physiology, not to any sick that the way woman is supposed to forget. Yeah.
Okay, so we go look at the normal and abnormal of menstruation later on inside the program. So we get any specific age where woman they begin for mess?
Yeah. So the age for make woman begin mess na around 11, 12 years. But some people then they can actually get a early menstruation as early as 9 years of age. Then if be say you menses no can take it past 40, take 16, then that time you go actually need for care that person they go see doctor for make it find out why make that person not begin seeing period. It because na something way abnormal where you don't pass 16 years. But if you begin seeing period again before 9 years, now also something way abnormal, you go also make see the picking.
So is it compulsory for let all women see in menses?
Now, as I said, na biological function, we suppose for see periods there, because if person don't see in period, it go possible say na woman, but something in not get womb way function or something block na making not see the period. But as long as that woman they don't reach the age of puberty, now one of the processes the way they happen where they reach puberty, apart from where they grow hair, grow body. For CU menses also na part of normal part of the process of puberty for woman.
Okay, so what it mean for let woman dey in no mess?
Where woman no see in period, the first thing we would think of e get belle or e no get belle, because na the number one reason that they will go make person not see in period. And then the other reason go be say e get problem with the outside the menses the pass, like say e get blockage na in vagina or in cervix. That's na one way. And then it can be say e get hormonal imbalance, or it could be say the person get some medical condition like if you get diabetes or thyroid disease, then when they make person menstruation get problem, or things like polycystic ovary, that are like they get small cysts there inside the ovary. Or it can be say then people that way na athletes there waking deep and then intense physical activities there also can make them they can get issues with their menses there. Or somebody can even do on contraceptive some form of contraception there, like now would they say birth control method. It can be say na injection, it can be say na tablets, or it can be say na the implant. Some of them can also cause abnormalities there in the menses.
Okay, waiting are some of the risk factor the way this go create in that area the way you don't explain. So
like where woman on the see menses.
Yes.
First it creates anxiety for the woman, because it will begin to think say I get belle or I get sick, and then the first you want know. And if na belle, then you know say belle the normal process now for wait say the person born the pikin. But if not to belle, then you want know why make this person in the same period. If it be say now let's say outflow tract problem, let's say outside the menses for pass or common it get blockage, then you go need for do something for open that, because if not the blood get for the flow, they go back inside in belle, and we go lead to more problem. It could be pain every month, you go see pain or other thing. And if you be saying like then medical condition, then it go signal say problem is the way it needs for solve. If you don't solve something else they happen at this person body. So for CU means as long as you didn't have the reproductive age, you need for CM. Except for those where then they on contraception, like the implants, the injection, like they will take their pool. So if you know the see in period, as long as you know say it is stick to the plan, the date we're supposed to get the injection, if they get at that time, then you no need for worry. It could just be saying that just one normal part of or one of the side effects then of the family planning way it take. But if you not dey on any family planning, then not supposed to really na athletes where they do all them intense physical activity, then it could really need for get medical checkup for know why in not the same period.
So we get any specific days for say this na the time wey are the semi period, or is it that a different for every woman?
A different for every woman. People then they na like range.
Okay.
E some people then they get luck, they say then go see them period. If they say na the 15 or the 16, it go always count the 15 or the
Like I
16.
dey talk about 3 days, some 4 days, some 1 week. So is it that we get the specific days?
Yes, so we dey expect say the person in menstrual flow is supposed to dey between 2 days unto 7 days. You go say this na normal, but if you get menses below 2 days or so, then you go say this person in menses too small and the number of days small. Then if you don get menses wey don pass 1 week,
Okay.
going 10 days upwards, then na abnormal. We dey call am abnormal uterine bleeding, because that person dey in menses e no dey within the normal range of days wey e suppose to see im period for, and that can even get side effect on the woman, because e go bleed more than wetin e suppose to bleed. E dey lose blood, e go make you begin get anemia, and then maybe e go be say na problem wey you get, let's say something na fibroid dey make that need dey happen, then you go need for address am.
Okay, so I go refer to woman the way before say they see the mess is very small, and we get some woman them where the mess. Some man they say and every before use pad pass I use pampers, and the mess is they overflow. So how you go refer to that? Is it that na normal or na abnormal menses standing?
Na abnormal menses than dey.
Okay.
The normal menstrual flow wey you suppose forget na like 80 mils. 80 mils na like something small. E no reach 100 mils na the normal menstrual flow, but some people they can get above that or they can get below that. But if you be say per day you wan get dey change more than 3 parts and heavily soaked parts, then it means say your menses e look heavy. If you be say na that kind menstruation dey wey go even disrupt your daily activity, say the flow so much that you no go even wan comot go some side and gats say make e no embarrass you, then na abnormal menses than the all and what they call am abnormal uterine bleeding.
Okay.
So e go mean say you need for see doctor for make them correct that your menstrual flow for make e normal, and look for wetin na the reason why make this dey happen.
Okay, so wetin are the difference between menstruation and bleeding?
Okay, so menstruation in a regular something wey dey happen, na e dey part of your physiological process, even though na a form of bleeding. But when you say bleeding per se now, na like you dey bleed from the vagina or any part of the body wey e be say not to normal something than the way suppose for happen. But for like woman then period C1 or woman then with period C1, na thing than the way na so God make we, as we reach puberty na thing wey suppose for happen regularly until we reach the age of menopause, wey dem go say this one e don stop now for seeing period. But bleeding now na like e go be say somebody get belle, then the belle dey waste, na e begin see in period, e begin see blood dey come up another 10 day, not to normal period than day, e just happen abruptly, e abnormal. So now you go say, well, this person they get bleeding, or it can be say something not so you not get belly at all, safe, but then it bleeding just starts. Something a fibroid or something a one form of cancer you get and all.
Okay, so wetin na the age wey person wey woman dey reach for when they say this don reach the age of menopause?
So menopause can start any age above 45 to 55 years. Now the period than the way menopause can happen, not to less fixed age, but a range from 45 to 55 years. Within that time, the person go begin to feel like sometimes he go get hot flushes. He go just feel say, some people then they know they fish too much heat. He go begin get even in temperament can begin change. Then he go even begin to feel some dryness of the vagina and all. So all and they go begin say, oh, this why the period don't begin go. And around that time, some people they can actually get abdominal uterine bleeding, meaning the period can delay, can come, and then sometimes they can just get breakthrough bleeding, where it go just come abruptly, or they begin see the menses heavy, and then time go reach now it go.
Okay, continue for the with me na the program. A name na Dr. Rosalita Jaida Tugagu in the Senior Registrar Obsen Gaim Department na the University of Salon Teaching Hospital Complex as in there also today for talk about menstrual hygiene and dignity. The program now well body talk they come to you live from the Society for Radio Democracy 98.1 FM. Remember say yourself where they listen and watch you live na Facebook. You go be part of the program by where you go send a comment or text message to the number 077981981 or self you go na Radio Democracy Facebook page. And later on we'll get for open phone line. Also people go call the number 077981981 and ask question about the topic where they do it today na the program when a menstrual hygiene and dignity. The program well body talk they continue and today inside the program we report them being go na different side and a Freetown and talk to woman about waiting they understand about menstruation. Also we reporter Janet Masako and Elizabeth Matu Masare been talk to them different people here so.
Well, menstrual cycle na the monthly period we they see in a month we as woman dey. So when they see that monthly period they need for the take care of himself, clean himself, wash 2 times per day, for say that thing they get fine smell. For go able for maintain himself as a woman. Let me say at least 2 times per day. Because woman self you need for the wash 3 times per day because woman ain't get the cleanliness. So at least you go make am 2 times per day if you know able wash 3 times per day safe. If belly the heart, if body they swell, if body the heart, the flop, belly the heart.
Of menstruation because of we don't mature. I dey begin for mess. But the starting of menstruation, sometimes the symptoms so they happen to you. Sometimes the belly the heart or it bobby the flop by you. I dey feel sad, I know feel fine. Sunny pad, I can use. Catch, they come up and I feel okay because I work and I feel fine.
Well, what I understand, say like when the egg they don't fertilize, then can break down in you. So that can make women they go through that menstrually. Some na once, some na twice. Based on how they bleed or how they use your menstrual pad. The pad they use that is sunny and it is nice. Yeah, the one they safe for me because I feel no inching and I'm okay with that. Like I don't use one of a time because it makes rash on me. That's why I use them, paste them, I try for pull them out, so I take them pills for take away infection. But I'm not saying out of that. Now based on the pad I use because like not too good and I never use them before. At times me can act, I can just feel weak because any carry something in me they come out. So I they get a lot of blood when I bleed too much. So me it can act me at times that I feel weak. The only thing like some can use pieces, you can say that they safe for them. Because if you start for use pad, you meet up the one will not fit your skin. As you feel the inch, and for stop for use that. Because if you continue, it will cause all that thing. And right now, sick day, and that sick day starts from the private. So whether it come from pad, they not go care. Everything they know, and the sickness. So whenever you feel inch, and for stop for use that, continue with the one way you know say yes, it fits you.
Well, that's not some people anyway. We reporter Janet Masako have been talked to about we to understand what menstruation is safe, how they can feel where they can want for mess and safe during the menstruation period. Where doctor you don't listen to some of the thing way some women don't talk about waiting then they feel before they mess and during the menstruation.
Yeah, the whole menstrual process, it get what we call menstrual cycle. So the menstrual cycle, it gets different hormonal changes then we can happen. It can get effects on the ovaries then that's outside the egg then can form per woman, as well as it can get changes then back we can happen now inside the womb, inside the uterus. So when the cycle starts, first when the period done, the lining of the uterus they begin grow. And that's when the egg back they call the follicles there. That are the outside the egg, the small cells that we get around the egg.